Good afternoon, everybody, and welcome to today's Better Managers Briefing. Happy Friday. Each week, we try to explore the topics in management and leadership that really do matter to you. And today, I know, will be something that matters to us all because I'm delighted and honored to welcome two leaders from the National Health Service who will share their experiences with us, including observations on how to manage in a crisis that we can all benefit from. And the first of those is our companion, Samantha Allen, who is the Chief Executive of the Sussex Partnership Trust. Welcome, Sam. And secondly, I'd also like to extend a welcome to the companion, Rosalind, who is the Deputy Director of Organizational Development for the Royal Berkshire Trust. So welcome, both of you. I know it's been an incredibly busy time. And Roz, earlier when we were speaking, you said, unlike other organizations, the NHS simply just can't close the front door, but must always be on and operate under incredibly high stakes and incredibly high pressure. That creates particular management and leadership challenges. Could you share those with us? And how is that different, perhaps, from other management and leadership challenges? And maybe I'll start with you, Roz.
Okay, thank you, Anne, and hello to everybody that's listening from various different sectors. So to put things in a little bit of context for you, I'm at the Royal Berkshire Hospital, and we're one of the biggest acute district general hospitals in England. We serve a large population of Reading and West Berkshire. Let me tell you about life in the pandemic at the Royal Berkshire. But I can begin by saying that no organisation had the resources or sufficient people to deal with the pandemic, no matter what sector you come from. So brand new territory, you have to start from the position of what you've got. And that really boils down then to what's the leadership in this situation, this unprecedented situation. And people can talk about winter pressures, they can talk about other things we've faced, but it's been nothing like the scale of this. And what does it actually mean for management? And is there a difference between the leadership and management in a pandemic? Well, if I begin with the leadership, the visibility and the approach of the chief executive is absolutely crucial. Everyone looks to that person. They look to them for calm, they look to them for reassurance, and they also look to them for some of the answers. And the reality is the chief exec alone cannot have all the answers. So the visibility of other senior leaders is crucial in the situation. But very importantly, dealing with people on the front line and in the support services for their ideas. So we want credible, calm, creative, courageous senior leaders, and we need them to be communicating. And in our instance, our CEO, Steve McManus, was communicating every single day. So he became the anchor for our 5,000 staff. In terms of what did it mean for management, well, this is a logistics nightmare to be dealt with because you've got, the normal services that you would have to resume. So there's lots of decisions about who do you keep coming into the trust, who can actually wait a bit longer. And you can imagine the emotional impact on people that have already been waiting for services. But managers needed to work with teams to completely reconfigure the main site. So close down some wards, create what we call hot wards, COVID areas. How do you keep accident and emergency front door open without people feeling that it's dangerous to come in? How do you actually deal with visitors? And in our case, we had to largely stop those coming in. So you're stacking up the psychological aspects of this. Staff health and well-being and their safety, patient safety, crucial. But I think the glue that ties the leadership with the management has been about being willing to innovate, being willing to actually think in ways that previously unheard of. In other words, you haven't got to go through layers and layers of committees and write papers in order to get the solution. And there's a freedom in that. And really importantly, the values of your organization are really tested in this, and those values need to hold. So if your values have been built by the people, which they have for us, that also becomes an anchor in the situation. And
so there that you're covering, and we're going to get into some of those a bit later on as well in greater depth. But Sam, you're a chief executive, and Roz mentioned how important visibility is. Maybe you can share your thoughts on this situation and how it's impacted the leadership and management for you.
Yeah, I mean, I suppose preparing for this conversation today kind of made me sort of go back really the weeks and the months, and in some ways I can't believe we're in the month of July really. Where's the year gone? I think our communities have been amazing, absolutely outstanding. But when we, I suppose, started to see what was happening around the world, so in Wuhan and then in Italy, and started to get a sense, I think, of the virus and the outbreak in London. I was actually up in Birmingham speaking at a conference, and I took the opportunity to catch up with a friend who works for a global bank. Now, it may have been the nature of their business, Sam, being a global business, but it became apparent to me just in that one night that her organisation was gearing up significantly for enacting their business continuity plans. And I had that drive back from Birmingham, and it really made me think about actually how we were preparing. And at that stage, the health service hadn't called its national incident. There was something starting to happen, but we weren't at the point of a national incident. Now, we call it a level 4 incident. When we have an incident like that, I mean, I've worked for the health service for over 20 years. It's usually over in hours. You'd be lucky if it goes into a day or two. When that incident was called and we are still in a national incident, you go into command and control. And I think, to pick up Ros's point around values, I lead an organisation of 5,000 staff across 2 counties, 120 sites. We have a very distributed model of leadership and management. And when you go into a national incident like this, you are going into command and control, which actually is quite counter the values, the philosophy as leaders, and also the management styles. So we had to adapt, and we had to adapt quickly, and that wasn't always comfortable either. So I think maintaining self-awareness has been important in terms of the immediate needs of the organisation, which is, we set three really high-level goals very early on: to keep our patients safe, to keep our staff safe, and to take rapid and pragmatic decisions in order to achieve those 2 goals, really. So it's moved us outside of our comfort zone. It's meant that we've had to lean into all of our knowledge as managers and leaders. I like to lean on Ken Blanchard's model around different situational styles of leadership. But I think as a leader, we've also have to be thinking about the future. Where are we navigating our way to? What are we learning, and what are we changing along the way? So I think if I just go back to where you started, which is the NHS doesn't close, it doesn't. We're a public institution. Expectations are high, and our staff have been amazing, but they are human as well. We have to look after their well-being. We have to look after their safety. And, this has truly been a marathon of marathons, not a sprint. And I think that leaves us with a lot of the challenges on the management front.
Yes, and that actually segues very well into my next question. You've both referred to this is a marathon of marathons, as Sam just said. And, there is no clear end in sight. So how do you sustain your teams in this situation, and yourself? How do you make room for decompression, and what's your advice here? Maybe Roz pick that up for us.
Sure. I think the psychological well-being, health and well-being of staff is absolutely paramount in this situation. We got nationally some excellent advice, particularly from the military, about their learnings on post-traumatic stress disorders and actually how best to help our staff. Now, teams need time to talk about what they're going through. Things like daily huddles become really, really important. I mean, you have to have a socially distanced huddle, but a huddle nevertheless, where they can actually explain how that day, that shift has been for them. Also providing sessions in a safe environment where they can unload what they've experienced. So I think sometimes, you can think of a nurse is a nurse, therefore their experience, there's commonality. But for nurses that don't work in areas where there's a high death rate, to lose 10 or 12 people on your shift is traumatic. I think providing the support through occupational health, and we had terrific support from our mental health trust that's out in our community, and encouraging people to look after themselves, to have their networks, to be able to spend time where they could with families, to take a break has been really important. But there's a long way to go on this. Really, we don't know the full effects upon staff. So we will continue to provide those sessions and those outlets going forward, and we will preserve some of the good things that have happened right into the future, no matter what we face.
Well, we're going to come on to that, but Sam, how have you been managing the decompression aspects and the well-being?
Yeah, so in the NHS, through our National People Directorate, they very quickly, again, drawing all the evidence, evolved a model around kind of prepare, the active and the recovery phase. And as you can imagine, the NHS is a massive organisation, and the challenges that everybody's facing are quite different. And I think also the lived experience, so people have got, range of conditions, caring responsibilities, childcare has been a real issue. And I think for us as an organisation, we, within 3 weeks, moved to having 2,000 of our staff working from home. I think holding in our minds that they aren't working from home under normal circumstances, they're doing their best in a crisis. So 24/7 helplines, using digital apps, so really giving our staff, signposting them to all of the wealth of resources that are out there. Compassion check-ins is another thing that we've been doing. We've been doing those virtually, a really safe space just to come together, ask how people are doing, what are the struggles, but equally what's going well as well. So maintaining that sense of optimism and hope and togetherness, that we're all in this together and we will come through it. But you've got to I've found you've got to double your focus around how people are staying connected. Actually, the virtual world is draining and tiring for people. So encouraging people to take breaks and time out, hugely important. We've done some work to look at, actually, on average, people have been working 10 to 20 hours more a week, just on caring responsibilities, and that's not actually the work. And there's a huge evidence that says, do you know what, we've had the first wave of this pandemic, but the second, third and fourth wave will really be the mental health aspects of this, the impact of the economic downturn, the complex reactions to bereavements. I don't know about either of you, but I have suffered a close family bereavement during this, and it's indescribable, actually, what you go through, because you cannot grieve in the way you would during normal times. So I think for us as an organisation, it's not going to be a case of packing this away, because the vaccine will come for the virus at some point. But we've got to double our efforts now on wellbeing, and we've got to be in this for the long haul for our staff, because they will go through different phases.
Absolutely. And, you both mentioned some of the trends that have really risen during this pandemic, the use of technology, and indeed the focus on employee health and well-being. And some of those trends, you've said, and many others agree, that you want to keep up in the new normal. And how will you do that? And what other management and leadership techniques do you think perhaps have had a positive aspect to them that you plan on continuing well beyond this crisis? Maybe I'll start this time with you, Sam.
Yeah, so I was thinking back when I was at business school. I did an MBA a few years ago at business school, and one of the great things about doing that in health services, you learn from other industry and other sectors. It's one of the brilliant things about CMI. Mm-hmm. And I looked at a study around innovation in the technology sector. So fairly early on in the pandemic, we decided to experiment. So we set up a team outside of our command structure. We gave them one mission, which is tell us what we're learning through COVID. You can go anywhere in the organisation. You can do this the way you want. The only thing we want back is we want back rapid results. We don't want a thesis, a slide deck, 30 days, tell us. We've just published the outcome of that, absolutely groundbreaking. And I think for us, the biggest revolution has been the digital revolution. So we've now got nearly 1,000 of our clinicians working online. We've been able to accelerate our use of digital, clear vision. Any patient should be able to request an online consultation. Any clinician should be able to offer one. We've done 16,000 so far. And if I tell you, in the last year, I think we've done probably less than 100 online. So that kind of tells you really that through adversity, some really positive things can come. And I think it's about trying to be bold, retain a sense of boldness that the crisis has enabled from a leadership perspective. Just let's get on with it. Let's do this. Let's put some pace behind it.
That's amazing. Ros, what about you? What are some of the learnings you'd like to share from this crisis that are good?
Well, I echo everything that Sam has said. And what we've seen, again, is a far greater acceleration of virtual clinics for the patients and with the clinicians and medical staff doing those. We've also seen, though, an acceleration not due to COVID. It's something that our ambition was always to go to more remote and flexible working. What COVID has done is made us do that quicker, perhaps not in the best way we would have wished to prepare for it, but it has shown how rapidly we can mobilise on the remote front. I think in terms of leadership and management, what it brings is we definitely need to do more on the development side for what's it like for a manager to, in effect, manage blended teams now, some at home, some in the workplace. How do we ensure that there's parity in the way those people are seen? You know, one is not less than the other, both are required. There is something about trust as well, that if you can't physically see your people in the workplace, your managers must trust that this work is being done. There's something also about understanding the domestic circumstances that people who are working remotely are in. Therefore, with the schools not being open, you know, if you're having a Teams call and toddlers suddenly appear all over the place on that call, it's about having the patience and understanding of what's going on there. And then we also need to look at what digital skills are required at every level in order to be a very efficient organisation. So those are really welcome things we would have wanted to do. We'd have liked to have done it in a far more phased way with greater understanding of impact, but that comes now. And there is such an appetite for learning, as Sam said, that's come from this, from the staff who have felt really empowered, and they don't want to lose that. Our chief operating officer uses the phrase, let's not restore factory settings. And I think that's absolutely right.
That's a great phrase, and I also love your "What have we learned during COVID?" Rapid response team, Sam, that you put in place. So there's some really great suggestions from both of you. Now, we've also heard a lot about diversity and inclusion during this crisis, and obviously through the parallel events around the world. And we know that everywhere in the world, the pandemic has disproportionately impacted Black, Asian, and other ethnic minorities. What are your thoughts on how we can change and improve diversity and inclusion, not only in the NHS, but also generally? Maybe, Sam, what do you think?
Yeah, and I mean, this is a global issue. I think it's an issue for all of us. I think in the health service, it's been a shocking and a sad time. You know, seeing the pictures of the over 300 NHS staff that have lost their lives to COVID-19 and the absolutely disproportionate way that has affected Black, Asian, and minority ethnic members of those staff. But those health inequalities actually for our communities have been there for years. You know, they're very stark, and we've got to do something about it. We've got to do something about it together. I think the COVID-19 kind of disparities, the impact on staff has shone a light, I think, for all of us as institutions. And as I said, it's a global issue that diversity and equality is, the work is not done. In fact, we probably haven't even really started yet. I think the death of George Floyd and the Black Lives Matters movement, in terms of really identifying that racism is an issue. It's quite endemic and systemic across society. There are structural barriers in the way, and we all have, I think, as leaders and managers, whatever sector we work in, we have a role to dismantle that and address that. So in my own organisation, that's led to really different conversations about starting to kind of really think, how can we be actively anti-racist? How do we really have meaningful conversations about the structural issues that we've got in place? But how do we improve the outcomes for our communities? So I think this is one of our biggest leadership challenges, really, for all of us.
Yes, and Ros, what would you add to that?
Well, about a third of our staff come from the BAME communities. Yes, we have the forums. We do the things that happen in a lot of places, but what's become really clear is we need to get better, faster, and we really need to stand up on these issues. Now, we need to see in our senior leadership positions, a representation of not only our staff communities, but the patient communities that we serve. So we need to be doing all we can to remove some of those barriers of why are people not coming forward for their promotions, or if they are coming forward, what's happening that they're not getting into the post. We need to have a significant increase in cultural awareness, and we must work on that. We also need to do more about the mentoring that goes on, not only to the BAME communities, but from the BAME communities into the rest of our staff. Mm-hmm. And we need to be doing a lot more work with community leaders. And we saw during Ramadan, our Muslim community bringing food in for our people. And we need to have more conversations around how we all work together. But there is also the issue of white fragility that we need to address. Some really good work from Robin DiAngelo, and to really make sure that in putting all the emphasis onto the minorities, we don't also forget that there are issues around being white, and particularly male, and the white privilege. So we need to look at it right across the board and be a lot better at it.
Mm-hmm. Yes, thank you. By the way, if you want to ask a question, please do it on the YouTube link. We're going to be opening them for questions shortly. But my last question before we do that, Sam, you mentioned in our briefing that one of your learnings was about the need to work more closely with other communities and with the local business community and others. What advice will you give as to how you plan to do that? And what examples really stood out for you, and how could other organizations perhaps listening help the NHS?
Yeah, so I was overwhelmed by the business community in the way they rallied around the health service, supported our staff, supported our patients during this period. Absolutely fantastic. And I think from an NHS perspective, we should be an anchor institution in our communities. We should be contributing to the economy. We should be supporting employers. As a provider of mental health and learning disability services, we've got significant expertise around well-being and psychological aspects that could benefit employers. We've got assets, and we're big carbon users as well. So if we invest more in our local businesses, if we can, my organisation is in Sussex, really conscious at the moment around the impact on Gatwick and the numbers of furloughed staff. And right across the health service, we've got 100,000 vacancies. So how can we use our resources and our assets to benefit our economy? A couple of things that have really stood out for me during this period. The digital revolution I shared with you. We've got access to platforms that our voluntary sector organisations don't. And the YMCA, we offered them the platform so they could continue their counselling for children. They wouldn't have been able to do that if we hadn't been able to offer that. And equally, we would have had more demand coming into our services if their services stopped. So we've just got to join up on some of these things. And then more recently, we've gone live with something called Project Wingman, where furloughed airline staff, stewards, pilots, I think, Ros, you've got this
yes.
as well, are coming into our hospitals and providing a lounge experience for our staff. Absolutely brilliant. Well, I'm hoping to recruit some of those staff at the end of this if they're thinking about different careers. So, you know, we should be, I think, creating more opportunities for leaders across business and in local areas to come together with their healthcare partners to think about what we can do more together for our communities.
So those are great examples. Roz, what about you?
Well, we have a strategic alliance with the University of Reading Headley Business School as well, but this has brought it to the forefront of just how much joint working we can actually do. You know, how much we can benefit from the premises of the university. Can we set up joint teams? The research, all those aspects, I think now become accelerated. I echo what Sam was saying about Project Wingman, quite incredible level of support. And yes, we'd love to have people who are going to lose their jobs working in the hospitals. Our volunteers have been amazing, and the volunteers out in the community that we didn't even know about, who've been making scrubs and the gowns and the masks and sourcing protective equipment for us. And then we look at the local businesses supplying the food, and we had a pop-up supermarket, we had something that looked like an Olympic village, we had Rockstar tour buses for people to relax inside of, and we've had businesses donating laptops and the iPads so that patients have been able to stay in contact with families. But what it shows us is that when we talk about being connected to our communities, we thought we were quite good at that, but this has shown there's so much more we can do. And what we mustn't do is say, well, thank you very much, that's the end of it, because it isn't. So we want to build on that and bring those sectors together, small business, big business, because we are all in this together, and actually make sure that we have got coalescing of people around us as we go on through this. It really has been incredible, and we must pay attention to our care homes, because there's so much more we can be sharing with them, doing with them, working with discharge teams and enabling them to thrive as well. So there's a lot to do. We need to do it together.
Great. Well, that's a wonderful note to end my questions on. I'm going to open it up to the audience. My first question is from Mark, and he says, have you seen examples of leaders emerging from teams during this crisis, and perhaps unexpected surprises, maybe people you didn't expect that of? Yes. So Roz, you're nodding animatedly.
I absolutely am. You know, we have a talent management program here that is inclusive, and we're proud of it, and it's in its early stages. But we have seen talent emerge in this crisis that we never knew existed. So they were, you know, people that we've not talked about before, they've not been on our scope, and we've noticed that they've been taking charge, taking responsibility, being agile, coming up with things we'd not thought of. And so we're like, whoa, we have to capture this. So yes, we have seen leadership in unlikely quarters, and we need to make sure there's recognition for them.
Yes, indeed. And you know, they certainly deserve it. Sam, what about you?
Yeah, I mean, it'd be hard to single any one person out, but loads of examples of that. I think probably the biggest lesson for me and my executive team, though, is that we can ask a lot more of the organisation, and not to be so, I think, kind of siloed and hierarchical around our thought around where to go to for solutions, but actually finding ways for connectivity across teams, right across organisations. And the feedback we've had is that the teams have really found the collaboration really positive, and also the parking of any tribal boundaries that existed either between teams on issues. So I think it's shown us a real glimpse of what the organisation's really capable of, and it's that we want to keep going. And I think we reflected that we need to change as leaders if we're going to maintain that.
Mm-hmm. Well, this plays beautifully into my next question, which is from Hugh, and he says, will the reported rapid decision-making, and staff empowerment, bypassing what he's saying is the usual NHS committees and other administrative processes, be maintained. Well, Sam, what do you think?
Well, that's certainly my intention. You know, the NHS is a complex system. If you ever want to know how the NHS works, Google it at the King's Fund, and there's a really great animation, and it's quite mind blowing actually in terms of the number of organisations involved. But as an organisation, you know, that covers 2 counties, 5,000 staff, we are at the moment embarked on making active changes to our executive governance. So my vision is that when we come out of the command structure, we will transition into a new way of working. We will not revert back to the old way of working. So, you know, I think the best change you can lead is local change, take control and ownership of that. And that is certainly our intent.
Great. Ros, what about you?
Well, I'm sure if my boss is watching this, he would say, yes, she's the one that's allergic to bureaucracy and papers and committees and all the rest of it. That said, you have to have a level of governance. You know, this is public money, public safety. So, of course, we've got to have accountability, and we will still need some governance structure. Outside of that, though, this distributed leadership, actually having decisions made at the lowest level that you can have them made at, and having improvements and ideas at that level, we need to keep that going and to not lock people back into hoops to jump through that really are not necessary. So I think that part of it's really very exciting.
Great. Okay, time for a quick last question from Gracie. And if I could, maybe you can give me your rapid fire answer to this. What's the next key leadership challenge in the NHS? Sam.
So during COVID, people were not accessing services in the usual way. So our next key challenge is tackling the waiting lists that have built up, making sure that people do start to access healthcare if they've got symptoms and issues, and that they're getting the right intervention, the right treatment, the right support in the right place. And then just finally, I would say, maintaining the well-being and resilience of our workforce and filling our 100,000 vacancies that we've got across the health service. That's going to enable us to inevitably meet what has been a bit of stored up demand, but also in mental health services, we are fully anticipating we're sadly going to be busier than usual, because, as I said earlier, the evidence around when the economy's hit, the complex bereavements, the trauma that people will have gone through over the last months will be coming down the line over the weeks and the months ahead.
So lots of challenge. Ros, what's your quick thought on that?
Similar, the recovery and bringing back the services, what's the pace and rate of that, given that we still have to have readiness if there is a second, third, fourth wave. Going into the winter pressures later on, what's the impact on that? Absolutely health and well-being of staff and patients on the mental health side as they come on through. And also, I think for me, really ramping up on our diversity and inclusion agenda.
Mm-hmm. Great. Well, both of you, thank you for everything that you shared with us today. You've been amazing. Thank you for all you're doing for everybody in the country and keeping everybody safe and protecting us all. And it was wonderful to have you both. Thanks so much. And thank you everybody for joining us.
Thank you.